Hello, my name is Laura. I am 28 years old and I work here in UR Vistahermosa as an international patient coordinator. I'm here today not as a worker but as a patient because I'm going to have my first consultation with Dr. Malcasian in order to set up the steps to preserve my fertility. I would like to explain why I'm doing this, and it's just a simple reason that I realized after working here for quite a few months that low ovarian reserve is quite an important issue. More and more women my age and under my age are suffering, and I would like to become a mother in the future, but now is not the moment for me, and that's why I'm taking this decision today. So please come with me to the consultation. So Dr. Malcasian, it's really nice to see you today, not as a worker but as a patient, and I really hope you can help me solve my doubts and set up a proper treatment plan for my case. Okay?
First of all, please call me Susana, okay?
I will. Thank you. So my first question would be, what is exactly ovarian reserve and how can I take care of that?
Okay, when we are talking about the ovarian reserve, we're talking about our capacity to produce eggs, okay? And it's very important for our fertility and to have kids. We have two options to know about our ovarian reserve, and we can perform a blood test and see the AMH. It's like a hormone that can talk us about the ovarian reserve, and we can do the ultrasound. It's a scan that we perform on the first days of your period, so we can see the antral follicles in your ovaries and we can count them. So these both things can tell us about your ovarian reserve and if it's normal for your age or not.
So what would be a good level of AMH hormone in my age, in my case?
Okay, you have 20 years, you are 28 years old, right?
That's it.
Okay, so at this age, normally the levels of AMH are normal, and I think that it would be between 2, 3, maybe 4, okay, in good levels. Normally we consider the low levels of AMH when we're talking about under 1 nanograms per milliliter. It's the lower.
Okay.
So first of all, if we do this test and we can see that you are in the normal limits, we will know that your ovarian reserve is okay for your age.
Once we know the AMH levels and also the rest of the hormones, the antral follicle count, how would be the procedure? How would I proceed in order to preserve my ovocytes?
Okay, normally the treatment starts with your menstrual period, okay, with your cycle. And before that, we will do a treatment protocol for you when we would know these levels of AMH and all these things. So we will explain you how you have to put the injections of the hormones, because what we want is to stimulate your ovaries so that all the follicles that can grow up in the cycle to get as much as possible, okay? So you're gonna start to make the injections. It's like it lasts for 10 days normally, maybe a little bit more sometimes. And we will be performing the ultrasound scan to see how the follicles are growing, okay? So when they have the normal measures that are okay to perform the egg collecting, we're gonna program the surgery day. And this day with the anesthesia, okay, so you will not have pain. No.
Perfect.
Because it's like fell asleep and that's it, okay? The procedure usually takes for 15 minutes, okay? And then you will stay in the hospital for a couple of hours to see if everything's okay, and then you will go home. Normally the next day you can make your usual life, okay,
Back to normal